Doctor, I was thinking today, so often I think of how love impacts our lives. And you know me, love and orthodontics, love and dentistry, love and life. And the thing that I want to talk to you about today that just hit me the other day is that you can love your people through. You can love your staff through, dot, dot, dot. I will explain. Versus letting them make you miserable. Now, in Abu Dhabi, I can tell you that I had at least 20 patients, or parents, should I say, who could have made me absolutely miserable. And indeed, I took some notes when I thought about this because they absolutely would have been my most difficult parents to deal with on a regular basis. And when you're doing orthodontics, boy, you're seeing them every month. Oh, that could have been disastrous for me and for them because they weren't happy. And so here's the thing. I want to tell you that I was able to find inroads to love them and actually turn them into patients in almost every case, only a couple of exceptions, who absolutely felt loved, who were so loyal, who couldn't wait to come in and see us, who hugged me when they walked through the door. Can you imagine? After giving me the hardest time in the world initially, or giving my staff the hardest time. You know how it works. They give the doctor a little bit of an edge or a shoulder, but the staff catch it. You know what? These people turned into loyal, wonderful people because they felt loved. The same thing happens with your staff. Now, let me just say right here and stop for a minute and say there are people who don't fit. There are people who aren't going to be able to use the love you can give them and feel it and feel that they are worthy or significant. Those people, no matter what, you have to cut the cord. You have to say to the staff member, I don't think we fit, and I'm so sorry, I would like to. You have to say to the parent, I don't think I can meet your needs, and I'm going to ask you to seek care elsewhere, and I can help you if you need help, and so forth and so on. There are times, but for the majority, and I'm talking in the 90%, you can take that love, shower them with it, and turn them into incredibly beloved patients and parents, and they will absolutely sing your praises. How do you do that? You just love on them. You tell them how glad you are to see them. You're real upfront and straight with them if you're catching an edge, and say, can I do anything to make it better? What is the problem, or is there a problem? You have to address it. But then when you do, and especially these folks often say, there's no problem, but you can feel there is. But a lot of times that's the end of the problem because you cared. So you just have to see what works for each parent, but love them. Actually give them your best, your most, and see what happens. That's it, Doc. Go for it. I want to hear your successes.